If you don't know me, my name is Kevin Scorsone. I'm the manager of political engagement with the North Carolina Nurses Association. This is our second video in this series. Once again, I'm joined by Mary Graff, MSN, BSN, and a past president of NCNA. And today we'd like to welcome on Elaine Scherer, who is an MAED, BSN, RN, and a past president of NCNA. So Elaine, thank you for joining Mary and I today. We're happy to have you.
Thank you for having me.
As we have started to explore all these different avenues, we want to take this video series. We've started to get some questions in and some topics of discussion. So the first one I wanted to talk to both you and Mary about as past presidents of NCNA is how you've seen the legislative advocacy grow from maybe even when you started as a member of NCNA to when you became president to what you're seeing now with the efforts that are being done throughout the legislative advocacy program with NCNA.
So I think it has absolutely grown exponentially. Nurses are on the front lines. You're starting to hear nurses being quoted in the newspapers, online, in the national news shows. It's actual nurses talking about nursing care. And if anybody thinks that we are going to get additional PPE by talking to our hospitals, that's not going to happen. We have to talk to our legislatures. So you've got to get your voice out there. This is the prime time. Nurses are the #1 trusted profession, and now we're proving it out there on the front lines. So I think this is a perfect time for us to advocate for what's happening with our patients in North Carolina.
So, Elaine, I think you're absolutely right. And over the past, let's say 5 years, we've come together with our day at the legislature, which, as you said, was a phenomenal success. We had over 1,000 nurses there last year on the lawn at the General Assembly. I mean, it was awesome. It was awe-inspiring to see all those nurses there, just incredible. And we have increased our partnership with other nursing organizations across the state. So I think we now have at least 11 organizations that are partnering with us, that are helping us to put on our night at the legislature. It's a fairly new endeavor that we started about 3 years ago, where we host an evening reception for all of our legislators downtown. They come across the street to the museum. We provide them with a little adult beverage and some very nice food, but also there are nurses there, and we've had 300 to 400 nurses at that event, just there to talk to their legislators. And that sends a message. It sends a message that we are engaged, that we are involved. And overall, if you look at how great the organization has grown, right? We're over 7,000 nurses right now.
It's amazing, Mary, just amazing.
It is amazing. And I believe that we are like the 4th or 5th largest state nurses association in the country.
Well, I think we're the best.
Well, there you go.
In my opinion, my humble opinion.
We are certainly the best, but there's power in those numbers.
Yes.
There is power in our voices. And I think nurses too often don't recognize that. I think this pandemic has changed that. I think people are now listening to nurses. They are now understanding them better. And I think that we have the opportunity to, carpe diem, seize the day, and really take this momentum forward and be a presence in those legislators' offices and with their staff and in there, so that every time they address a healthcare issue or they look at something, their first thought is, what nurse can I talk to about this? Exactly. Who should I call? So, I'm just, I am more than thrilled. I am over the moon with the way we have progressed, and working with Kevin and being down at the legislature during the last session every Tuesday. I can tell you that it makes a difference, that our presence there is noticed, that our voices are heard, that people are listening to us. So, we just have to just keep building on this.
Absolutely, Mary. The other thing that I've noticed during this pandemic is that tweeting, nurses who tweet, it's pretty interesting. I mean, when I was president, I started getting a Twitter account, and I started slow, but I started putting comments in, and I've continued. And actually, I really love it because a lot of nurses are getting on Twitter, administrative type nurses, bedside nurses, all kinds of nurses throughout the country. And we hear stories from the front lines, and those are incredibly powerful. And I'm seeing responses from some of our legislators, because I'm attached to every one of them, and I put on there about nurses, and of course I put on there about the SAVE Act. And you know, maybe if they hear it enough, it'll start making sense, because they're seeing how important nurses are, and for the patients. I mean, you can see the groundswell support for nurses and nursing within the country, even, especially up in New York. You hear from nurses that have gone from North Carolina to New York, from all kinds of states, Oklahoma to New York, and they're tweeting about their experiences there. It is remarkable, and I've always thought that nurses were brave. It takes a very incredibly important kind of courage to go to the front lines. In my Navy career, I learned that, and I'm watching civilian nurses do the same, and I am incredibly impressed. We need to let our legislators know what we're doing, why we're doing it, and now is the time.
Right, exactly. You know, during our last video, Kevin and I talked about collecting personal stories from nurses across the state, and I really hope that you all will share your stories with us, please, because we will take those stories and we will coalesce them into a very powerful message, and we will use that as we go down there and represent you. So, so please, once again, I'd like to put out a plea for that, for all of you on the front line. Elaine and I are both retired, so we can't share our stories because they're old stories. But you can share your stories, and I know that they're out there, and I know that they are meaningful and impactful. So please do share those with us so that we can use that. It's just another tool in our advocacy toolbox, you know, besides being a presence, besides raising money, besides supporting candidates. Stories are a powerful way to motivate people and to get your message heard. So.
Let me ask you both a question to kind of piggyback off of that first question. When Mary and I would go down to the legislature on Tuesdays, it was almost a running joke that they knew what day it was because they would see our faces, and that it was Nurses Day there. Do you think that there will be more of a, I don't want to say serious, but maybe that's the right word, serious response to seeing the Nurses Association down there in the future because of the work that nurses are putting in? You know, my wife is an emergency room nurse, and I think sometimes the work that all nurses do gets overlooked. But I think now this pandemic has highlighted just how brave and how hard the nurses are working. So do you think moving forward, this will make an impact at the legislature, but also with the way nurses are perceived maybe in that arena?
You know, Kevin, I agree with you wholeheartedly, because I think a lot of times the public in general is not aware of the depth of education and experience that nurses have behind them and how important they are to the team. They know they are once they feel it, but they don't really understand the training, the education, the certification, the licensure, all the regulations that are surrounding it. And part of that has been, you know, with the primary care area, when we have people that call themselves nurses that really aren't nurses. So I have found that my friends have a kind of a disjointed view of who is an RN and who is not. And I've instructed all of them to ask, but I think these legislators are going to look at nurses through a different lens. They're hearing stories from their constituents about being ill during this time, about fears of contracting coronavirus, of all kinds of things that they haven't heard before. And I think our world is going to be very, very different from this point on. And as we move forward, I think NCNA is actually at a perfect juncture to lead nurses in our state forward as far as legislature, rules, working with the Board of Nursing. I think it's really critical, the work that we're doing at this point in time.
So yeah, I think exactly, Elaine. And the other thing I would say, Kevin, is I think this statement, hi, I'm Mary Graff and I'm a registered nurse
Yes.
carries a tremendous amount of weight with it. Because when you say that, people stop and look at you and they think, oh, she's one of them. So yes, I think that when we are able to get back down to that legislative building and be there in person and have our feet on the ground, and we have our NPs down there and our CRNAs and our clinical nurse specialists and our registered nurses and our students that come with us, I think it will be hugely impactful, just because there is such a distinguishing factor to that title. It means a whole lot more to everyone today than perhaps it did a year ago.
I would agree. And you mentioned all different types of nurses, and I've actually been working with community colleges in the state recently to get them some information about advocacy and what we're trying to do. But I think after this pandemic is over, it's going to be very important to grow the profession of nursing. And I wanted to ask both of you how much importance will be put on, let's say, school nurses and community college programs moving forward after this is kind of in our rearview mirror.
So one of the things I would say is I kind of looked back over the past several years, and as early as 2016, we started working with the School Nurses Association to advocate for more school nurses. And I think one of the things that is most telling about this issue is that most people do not realize that there is not a school nurse in every school. That sometimes a school nurse is covering 3, 4, or 5 different schools. And, you know, with children today, we have an increase in our childhood obesity. We have an increase in childhood diabetes, childhood asthma. And these children, those 3 diseases represent a fair amount of childhood population within the state, and they are in our schools every day, needing insulin, needing inhalers, needing monitoring. And many schools don't even have a nurse there that can do that. So, you know, we have successfully worked towards, in 2016, 2017, convincing the General Assembly, along with many other partners, not just us, of course, that they should at least study school nurses and understand the improvement, which they have done. And I noticed in the most recent legislative update, the Governor Cooper has asked for an additional $70 million in his budget for school nurses. So I think we've gotten their attention, and I think they're moving in the right direction in terms of school nurses, but we have a long way to go.
Yeah, I agree with you, Mary. I think we've come a long way, but we do have a long way to go in that after this pandemic is over, whatever our world turns out to look like, we need more attention on mental health, physical health in the schools, and who better to do that other than school nurses? They know this stuff. I mean, they caught lots of things during my childhood, way back in the day when we did have a school nurse. Right. That school nurse knew who needed what, when, and they don't have that. You're right. The kids call the parents now. So I think that we can't lose that issue when we do reconvene our world and let it get lost within the scramble to figure out who we are after this. This is a great time to make sure that we have school nurses available to all schools.
Well, and you hit on a key point, and that's the mental health aspect of taking care of our children, because, you know, this pandemic is difficult for them. Their entire routines are interrupted. You know, they have lost their whole social structure. You know, they are now at home with parents who are also feeling stress, lost jobs, lost wages, uncertainty. You know, there's huge food uncertainty across the country. So these children, when they come back to school, and then they're going to come back into an environment that's probably very different, right?
Oh,
you know,
absolutely.
Some measure of social distancing, you know, not the same type of environment that they were used to. So they're going to need help. They're going to need help in adjusting to all of that. And so having nurses, having counselors, having clinical psychologists within our school system is going to be huge, huge.
It really is. Yeah, especially, that you think about the child abuse things and things that are domestic, the domestic abuse that has been going on. And when people are shuttered within their homes for a certain period of time, it happens. It happens to the best of us. Parents lose their cool, and kids may suffer as a result of that, not only with food and money and jobs and everything else, but yeah, they're going to need some support.
Yeah, for sure. I think too, I wanted to ask you both before we moved on, just from speaking with my wife and some of her friends and colleagues, the importance, even a few years ago, about their professors and the way they were taught nursing in college. Would you have any advice or anything that needs to be relayed once the pandemic is over to college students about how to handle moving forward in this profession?
I think be open and be prepared for anything at this point in time. And, care for self has really come out loud and clear on Twitter. We hear from a lot of the ICU and ER nurses, of course, because they're on the front lines. I think having a picture of nurses standing out there to the folks that are disputing governors' stay-at-home rules and saying we're attacking their freedom, and having nurses stand there and say, no, we're trying to keep you safe. It's a very different thing. I think we're going to be spokespeople now. I think we have to realize self-care is incredibly important, and we have to understand what that additional weight on shoulders of nurses is going to cause and what kind of support they need. And I think they can come to NCNA for that kind of support. I think we're going to be on there. Our board is well aware of what's happening, and we're prepared to step in and support them as we move forward.
I would agree. And in terms of nursing preparation and the professors in the community college and in the baccalaureate programs, I guess if I had one ask of them, it would be to please reinforce, as they are guiding their students through their journey, through their school journey, that they have an obligation to be a voice, that they have an obligation to be heard. We have not always been really good about reinforcing that message to our students. And if we can get them while they're in school, and if we can impress upon them the importance of their power, their message, so that they carry that through into their practice, not just advocacy at the legislature, but advocating in their environment where they work, being an advocate for their peers, being involved in the structure of their organizations, being involved in the decision making, being at the table, having a voice. All of those things, in addition to learning how to be a nurse, learning all the clinical skills and all of the knowledge that you have to gain, you need to have that sense of importance when you graduate, because nurses are the key to the success of anything having to do with healthcare in this state and in this country.
And nurses are the bridge between the others in our team, and we need to realize that as well. Communication is key. You can't get angry. You have to resolve the issue and move forward. It's leadership. I know we have that in the curriculum of the majority of the schools, I believe. And, we just need to take it one step further and learn how to use our voices in a way that moves the profession forward and moves all of us forward.
Yeah. Our next question, how should people, members specifically, who aren't near Raleigh or have access to, have access to get to Jones Street during the legislature, how can they make an impact from afar? I know Mary and I have talked about during this time about sharing your nursing stories, about signing up for Phone to Action, and I think we'll be putting that number here in the bottom of this graphic where you can text Phone to Action. But sharing the stories, doing the phone to action, emailing your elected officials. As someone who isn't in the backyard of Raleigh, do you have any advice to people on how they can make an impact from afar?
I do, Kevin. Thank you for that question too, because I think it's important to remember that just because we're in Western North Carolina, we're probably very, very far from Raleigh. But your voice can be heard. Call your legislators, get on their Facebook accounts, get on their Twitter accounts. Make sure you know when they're going to be in town. Join the town hall meetings. I signed up for a town hall meeting the other day with Senator Tillis, and I was in the queue for questions. Unfortunately, I didn't get on it. I was just so upset. But getting involved, and the more you do it, the easier it is. I remember when I first went to the day at the legislature in Washington, I was scared to death. And the same thing in Raleigh. I thought, oh, I don't belong here. But you do belong there. We are the ones on the front line. We know what the health of our citizens looks like. We know what they need. We know how to get there. And we are the members of the team that can do that. We speak physician, we speak team leader, and we can learn to speak legislator language as well. They want our stories. They want to know what their laws mean. They put out laws all the time, and the unintended consequences of some of those laws may not be known until they're out there and we actually feel what happens. To let them know what happens is important, and thanking them for their service. They don't make an awful lot of money, so they need to hear from us and they need our support.
Elaine, you hit the nail on the head, and that's to, look to engage with your representatives when they are in your area, because they're all there. They all come back home.
They do.
And they have office hours. And the other thing is they're members of your community. You can also look to your local public papers, newspapers. Sometimes you can write an editorial or an opinion piece about something if it's an issue. But there's lots of different ways to be involved within your community and make a difference.
Yeah, and I also wanted to bring up just how easy it is to register to vote now, which makes an impact, obviously. But you can register to vote online now during this crisis. And the fact of the matter is that the nursing profession can easily be affected by elected officials and lawmakers. So make sure you get out and vote and put the people in office that you think will put nursing at the forefront of their initiatives. And that's very important. And I think sometimes we forget how important it is to actually get out and vote and to play a part that way. So with the election upcoming here, it'll be here before we know it. It's something to focus on. So before we wrap up, I just wanted to say I've been here almost a year with NCNA, and when people congratulate me on the work I do or they say good job, I have to mention that the success that I have had since joining NCNA is in large part to both of you. So this has been great to talk to both of you and have this opportunity, and I appreciate you, and I know that our membership appreciates you both as well. So thank you very much.
And thank you, Kevin, for all your work.
You're
My
welcome,
pleasure.
Kevin. You're welcome. Thank you.
All right, thank you both. And hopefully everyone keeps responding to these and enjoying them. And Mary and I will be back soon to do another one. So thanks, everybody.
I'm here to serve. Let me know.
Thanks,
Good to
Elaine.
see you.
Will, Elaine. You too. Take care.
Bye-bye.